how far do you let your kid fall, for instance? When do we try to pick them back up again or intervene?
You know, I think when you get in a space of their behaviors being unsafe, that is really when you need to step in and get some help from a professional, maybe at Youth Zone. You know, talk about the possibility of therapy, talk about the possibility of you and whoever you're parenting with, go in and talk to a professional about a parenting plan, maybe that you need to put in place, and get somebody on your side that can support you and say, okay, these are some red flags. These are some things that aren't necessarily normal teenage behavior.
Right, right. So to that end, if somebody comes in, they decide, okay, maybe, you know, maybe I need a little bit more help with this. Maybe I do need to intervene. Let's say they come to Youth Zone. They come to you, Carrie, and they bring their beloved teenager in.
Yes.
How quickly can someone in your role assess whether this is a true mental health issue or something that needs some counseling even, versus this is normal teen behavior?
You know, I think in that first session with the kiddo, I really, as a therapist, do a pretty thorough job of assessing truly what's going on, what are the red flags, what have we seen in a change in behavior. So those first 1 to 2 sessions are kind of an assessment, get to know you, build rapport. My role in that is to create the greatest amount of emotional safety possible. So we really talk about confidentiality with both parents and kids. You know, sometimes kids come in and think this person is going to share everything with my parents, and that's really not the case.
So are mom and dad even present when you do your counseling?
Well, the ideal situation would be mom and dad or whoever come in for an initial parent consult. And that's where you meet with a parent provider at Youth Zone, and we just talk about how things are going. What are the roadblocks? Where have you, you know, missed the mark and it's been tough for you? And so we kind of, that way, get the parent perspective and say, okay, these are the red flags that I'm hearing from your story. I'm hearing these needs that you have. This is the plan that I think would help you. And counseling, usually a lot of time, is part of that. Sometimes family counseling is a part of that. Sometimes it's just individual parent coaching because the kid's not necessarily on board yet, which is okay.
Yeah. Okay, so you can help parents sort of manage the behavior issues that they're seeing at home, even when the kid isn't willing to come in and get some help.
I mean, we've done some work around that initially, of just how do you present that to a kid? How do you talk openly with them, talk about your own experiences and your own struggles?
So tell me about that. How do you help a parent? What would a parent say if they really feel like they need to get their kid in for some counseling?
You know, if I was talking to my teenager, I would say, you know, I love you enough to talk to you about this, because what I'm noticing as your parent, and you really talk about you yourself, you know, if you take the word you out of it, and you're not referring to you, the teenager.
Sending those I messages. This is the problem I'm having.
Yes, I feel messages. That breaks that wall down. So, you know, eye contact is important.